So my talk I called Linked, and that is Parkinson's disease and exercise. You've heard a lot of discussion about new treatments that are coming and hopefully come sooner than later. But in the meantime, I believe exercise is the foundation for everyone who has Parkinson's disease and for all of us who are aging. So I will just summarize some of the physiological effects of Parkinson's disease and aging and talk about the exciting changes that can occur in your brain and your nervous system across your lifespan. I would like to discuss some of the evidence supporting exercise for positive health and its contribution to maintaining function in patients with Parkinson's disease. And then I will outline my 10 commandments for patients with Parkinson's disease. When these slides are placed online for you, there will be a longer section on the evidence supporting exercise for Parkinson's disease and some specific recommendations for exercise. There is not time for me to do all those things in the 30 minutes that we have together. So I'd like to start with one example of an exercise program that we've been working on here at UCSF, if my thing will work. And some of you in the room have been in this program and know that we will and have taken pictures that we can share with these kinds of teaching opportunities. So contrary to the comments this morning about people needing habit and regularity, one of the things we're trying to promote here is rhythmic movements, high stepping, integrated balance, learning activities while exercising, particularly incorporating sensory cues and rhythmical movements. And we're also using high technology to try to make intense exercise more comfortable. Here you see somebody skipping in what we call the Alter G, which is a body weight support system where you're supported with air. And while either walking, jogging, or skipping, we are insisting that people do something else to try to engage their mind and control multitasking at the same time. This requires a little bit of ingenuity to keep people interested and keep people coming and keep people challenged throughout the 8 weeks of which we are trying to study the effect of this program. Fortunately, the person who is helping teach this patient is a dancer, a very good dancer at that. And even those of us who are not great dancers have a lot of fun, make a lot of noise, we have a lot of music, and people are really having a good time with their exercise. And if you haven't seen Brain Warp, you might want to get one. Kind of challenges you to find the right colors and sequentially run the numbers. And we're not too proud to do things that are fun, and we do have people at the same time working together, which is a nice way to begin to bring exercise to patients. And you see he's wearing kind of a tutu, which is the exercise pants that you have to put on to get into this body weight support system. His was falling a little low. There are many people that I see who don't think they can skip, they don't think they can jump, they can't hop. And one of the ways we encourage people to be more active is by putting them in a harness so that they do not fall. And here's a young lady who, after working for 8 weeks in the body weight support system, is actually back to jogging at home. I would like to confess that at the age of 70, I'm aging like you are, and it bothers me to admit that my brain is atrophying, because I didn't think it was very big to begin with, that my joints are degenerating, my reflexes are slowing, my balance is decreasing, I increase my fall risk, my bones are getting a little osteoporotic, and I have painful joints and a knee replacement. We also feel weaker, and we get older, we become somewhat habitual. We decrease the variety of our movements. We sleep more, but we don't sleep better. We forget more easily. We become isolated and often less flexible. And this is just with aging. If we add the classification of having Parkinsonism or Parkinson's disease, you not only have the signs and symptoms of aging, but you also have the problems with the tremor. Your muscles may get rigid, your movements are slow, your gait is shuffling, and there's freezing. Balance is compromised. You too are at risk for falling, maybe even more than I am. Have decreased memory, hard to get started, hard to stop, hard to walk, and talk at the same time. Difficulty in sleeping may be worse. Increasing joint pains may be more than mine. And there's also a change in smell and taste. But more importantly, you stop smiling, you stop laughing, you decrease your interaction with others, tend to increase your depression, and you may even have bowel and bladder problems. But what's fascinating is over the last few years, there's been an increasing emphasis on graceful aging. Healthy People 2010 said that society and the individual are responsible for keeping the brain and the body fit despite aging. Exercise is medicine. I didn't even realize there was such a program created by the AMA, and I happen to be married to a surgeon. And this program is designed to have MDs spend much more time discussing the importance of exercise with their patients. I give them a lot of credit for that. The American Academy of Sports Medicine and the American Heart Association also says exercise definitely improves health in our elders. So the good news is it's also the decade of the brain. Our nervous system is adaptable across the lifespan, even in the face of our aging, neurodegenerative disease, and chronic metabolic disease. We need to keep learning something new to maximize all of our neuronal resources. Learning-based exercise activities increase neural adaptation, often called activity-dependent plasticity. That word actually means that we can change our nervous system in response to physical activities that promote new skill acquisition or learning, and usually this is based on exercises that have adequate intensity, that have specificity, that you target some tasks that you want to achieve, that you can progress the difficulty of the exercise, and you can modify the complexity of the exercise. The brain doesn't change when you sit in the chair and read the same books and do the same thing every day. We can minimize the disability with learning-based exercises and creating positive health behaviors. We should eat a balanced meal, drink plenty of fluids. I can tell you many of us do not drink enough fluids to keep enough blood flowing to our brain and enough oxygen. We need to work and stay actively engaged in the community as long as we can, and exercise with exertion frequently and regularly. We need to exercise and do learning-based activities to maintain our memory, such as the activities she did this morning on how many items we could remember. Maybe you should write down how many items you can still remember from the list. But we have to exercise our mind daily, learn something new every day, make time to play, relax, laugh, and have fun, and break the habits and do something novel and new. Now, you might forget where you put your glasses, but that is not the worst problem in your life. It's much worse to be habitual and doing the same thing. So my mother used to always say to me, because I'm somebody who doesn't get regular sleep, she would say, early to bed, early to rise, makes a man healthy, wealthy, and wise. My mother is long gone, but I think she would have to change that today. Say early to bed, early to rise, along with work, learning, play, and exercise. Keep men and women young, healthy, wealthy, and wise. And my mother never did a day of exercise. So moderate aerobic, intense exercise does stimulate these brain growth factors that we've been talking about. It facilitates neurotransmitters, boosts your immune system, increases the oxygen to the neural tissues, reduces the risks for dementia, and enhances endorphins. I used to give a panel discussion with Mike Merznick, and Dr. Merznick is a very well-known neuroscientist here from UCSF and sort of the father of plasticity. And he is a very strong believer and have created many programs to help us all age more gracefully. And I used to kid him about his memory training, and I said, the problem with Dr. Merznick, your program is patients walk in a walker, They do your stimulating program, and their memory improves significantly, that they turn around and walk out with the walker. So I'm going to be promoting that you not only do physical exercise, but you combine that with learning, as Dr. Merznick has contributed. What's very interesting is moderate and intense exercise also maintain the length of our telomeres, maintain our strength, our endurance, our bone mineralization, our flexibility, and our musculoskeletal system. Maintains our heart and our lungs, and improves the variety of movement. And we are excited because Elizabeth Blackburn, who got the Nobel Prize this year, got her prize based on this look at telomeres and how to maintain the length of your telomere with exercise. Very exciting. Learning-based exercise also improves brain volume and memory. This is not just a joke, it's not just having fun, but it actually improves not only your memory, but we now know it also improves your driving skills, makes you more alert, less mistakes, looking around, seeing what's happening. And aerobic training, even without memory training, improves cognition in the elderly, and that's been increasingly reported. And aerobic exercises increase brain volume. Now, I'm an aging brain, and I can increase my volume by exercising 24 hours a day, but I will never have a bigger brain than I started with, so we need to be honest about that. And multisensory dual tasking is also a good way to do learning-based training. The most frequent falls in the elderly occur when you're trying to do two things at the same time. Walking and talking historically is described just before someone falls. So by doing this kind of dual task training, I can improve the timing and the sequencing across a variety of sensory modalities. I can modify the way my brain is topographically organized in terms of sensory, motor, and task representation. And in fact, I can actually train up and make things a little bit better than they were, but I can also overtrain and lead to some negative plasticity, of which we're not discussing today. So my exercise objectives for patients with PD is to maintain, if not heighten, balance, flexibility, strength, endurance, bone mineralization, and cardiopulmonary function for safe, efficient mobility in the community, and to maintain participation and independence. My goal is also to heighten rapid movements, alternating movements, and postural reactions that can help you protect against falling. And then to improve your confidence, your self-esteem, your well-being, and your alertness, and your cognitive ability. What I think exercise does not do, and certainly none of us spoke to each other before we got our presentations ready, but exercise at this time, I cannot say protects against developing Parkinson's disease, and it may not substitute for traditional medication management for Parkinson's disease, and it may not slow the progression of the disease or the severity of Parkinson's disease. But contrary to many things that were discussed today, exercise has minimal adverse effects. There are no risks for being active in terms of doing exercise. It can enhance the effects of your medications by increasing the on time and minimizing the off time, and it can slow down disability and dependence. So if exercise is good, how much do I have to do? Theoretically, we should be exercising, I think, 5 days a week for 30 to 60 minutes for low to moderate exercise, complemented with another 30 minutes of high-intensity exercise. That means getting my heart rate into that 70 to 80% of the maximum heart rate for my age. And if I do have a heart problem or a pacemaker, that I clear with my physician that this is still acceptable for me to work at this level of intensity. So what type of exercises do I have to really do? And I believe you have to do a variety. On the top of the list is low-intensity exercises, because there are several studies that just came out recently that I will discuss that suggest low-intensity exercises is good as aerobic, forced, or intense exercise. Now, I'm not convinced about that, but I do, in all fairness, have to share that information. Exercise should be challenging enough and require exertion, meaning that you should work up a sweat. And if you get out and you skip and you jog, you're on the elliptical machine, you're striding, cycling, paced walking, you should be sweating. You should earn a shower. integrate the strengthening, the flexibility, and the rhythmic and balance activities into everything you do. That is, you walk, you don't ride. You climb the stairs, don't take the elevator. And that you might even put a pedometer on and see how many steps you take in a day. And I would encourage you to put some ankle weights on, both your wrists as well as your ankles, to increase proprioceptive feedback and you know where your feet happen to be. And then integrate memory training with and without these exercise. So the research evidence for low-intensity exercise came out after the Academy meetings of neurology this summer, and Dr. Schulman reported that low-intensity exercise was better than high-intensity exercise. I've had a hard time finding the full study. This was an abstract in the neurology meetings, and it was a feature in the Maryland University newsletter, so I was able to pull that up. There's a serious flaw in this study, and I don't know Dr. Schulman from anyone, so I'm not criticizing her, but the low-intensity exercise group exercised for 60 minutes, 3 times a week for 3 months. The high-intensity group was on a treadmill, exercising 30 minutes, jogging on a regular treadmill for maximum heart rate, regardless of how hard it was for you or whether it had any negative effects in terms of your joint pains, your hip replacements, your knee replacements, etc. So really, everybody improved, but the low-intensity group, she concluded, improved more. But the problem is there's a serious discrepancy in the time committed to exercise that needs to be addressed. And as far as I'm concerned, if it hurts, you won't do it. And when you do it, it hurts some more, and then you do it less well, and then you're going to be unhappy. So one of my concerns is intense exercise and how you can do it when you have Parkinson's disease. When you do have joint pains, and we know there are some inflammatory non-motor associations with Parkinson's disease, you are weak, you have rigidity, you have poor balance, getting on a treadmill without some kind of assistance to protect you from falling may not be the best solution. So I feel today we have new things available to us to help us exercise safely at a much higher level. And one of the things that had come out this year was tandem biking. And I'm sure many of you had seen that article, and it was featured on the CBS News. And that is, you get somebody who's better than you are and forces you to exercise aggressively on your bike, and you pedal along, you go uphill, and you work really hard, and that has a positive effect on freezing and improving your mobility. Also, exercising on a body weight supported treadmill system enables you to exercise intensively and unloads your joints and allows you to be aggressive in both rhythmical as well as body weight intense exercise. So you can use these body weight machines over a treadmill, that's most common, and then you can use some over a bike, and then you can use some of these body weight support systems over the ground. And I've just listed some of these pieces of equipment. The benefits of unweighting is that it does reduce the ground reaction forces to minimize your joint pains. It provides some stabilization, so if you trip, you don't fall. It enables an opportunity to work in rhythmical movements like skipping. It optimizes your skill and ability. It pushes you to go faster than you would go on your own, and enables you to increase your heart rate at a slower rate if you have any kind of heart problems. So these are some of the machines that are out here. This is the glide track, which is like a bicycle. And then they have it in a bicycle, which you can ride over ground. You'll have to talk to Erica Pitch about that. I bought it, and I don't ride it in the city. And then we have somebody exercising on the glide track. And this is Alter G, which is your weight is supported by air distribution. There is an excellent series of studies reviewing the literature and the evidence supporting body weight supported gait training, not only for Parkinson's, but for patients post-stroke and other neurodegenerative conditions. And definitely there is a positive increase in gait speed. It improves stride length and improves the time that you can spend on a single limb. And one of the reasons we shuffle is that we don't feel confident to shift our leg into support with one limb to swing the other leg through, so we shuffle to have this bilateral leg support. And working on a body weight support treadmill has been rather an innovative way to improve that shift and balance. So how should I exercise then if this is what I need to do? I say get a friend who wants to exercise with you. Join a class, go to a gym. You can certainly do it at home, but it's hard to always motivate ourselves to do things at home. Use really good back mechanics. The older we get, the more problems that we can have with our spine. Warm up first with some good flexibility exercise. Practice getting up and down from the floor because there's going to be a time where you need to be there. There are some great video classes on exercises that you can do in front of your own TV. Then increase the repetitions and the time that you're exercising. Never hold your breath, breathe deeply, and think about the quality of your walking. Imagine walking normally and safely. Imagining doing a task will recruit about 30% of the neurons you would normally use to do that task. So you're wasting an opportunity to practice by imagining doing something normally. Watch people walk. You know, my kids always used to say, "Oh, Mom, how come you're always watching people walk?" And I guess because I'm a physical therapist, I'm always looking at the differences in the way people walk. And you might yourself notice some people run gracefully like a deer. Might read the book on barefoot running. And some people run like it looks like a major effort. And I'm on the major effort side of running. So focus on moving when standing, so you should never be standing still. You should be constantly moving. Concentrate on the individual elements of your gait. Pull those toes up, hit the heel, and take a nice long stride. Clear those toes so you don't trip yourself up. So what is a must? Standing tall is a must. And for those of you out there who have been in our program, standing tall is got to be like going to the 7-Eleven. It's a 24/7 responsibility. Go up to the wall and do a wall glide to bring yourself up tall. Monitor your posture when you're at the computer because we all get forward, our head drops more and more forward. We need to be tall. Rise and stand from your chair 5 times in a row, maybe every 15 minutes. Put some TheraBand around your thighs and push your legs apart and strengthen your hip abductors. Grab some TheraBand, raise your arms over your head, wave out that little tremor and a little bit of rigidity. I carry balls in my car to squeeze. I carry TheraBand to exercise as I commute. And I think we need to do this wherever we can, including when we come to a meeting and we're going to sit all day. So have a good mattress on your bed. Before you go to sleep, lie on a 6-inch roller and roll back and forth and get your back nice and straight and your head back. Mark your height on the wall in the bathroom, and every morning you get out of the shower, see if you can get your height back up to where you were the day before. I put on my dress this morning, and I realized that I'm shrinking like the rest of you because it's kind of dragging a little bit on the floor. Put up strategic mirrors and dots on cabinets, and every time you go by, pull your chin in, tuck your head back, and be tall. So what else? You got to minimize the abnormal movements. In my other life, I have looked at some aberrant learning phenomena that occur in plasticity, and the more you do something abnormal, the more you learn it. So you want to stop the tremor of your hand and your foot. Fiddle with something in your hand. I had someone tell me that when they go out to dinner, their hand is great, but then their foot is tremoring. And then figure out something to do with your toes, spread them apart to stop the tremor in your feet. If you have rigidity and freezing or falling, you might put some weights around your ankle just to increase that feedback system. There's a big push right now to wear a weighted vest. I've tried that with some patients. I'm not sure I'm totally on board with that, but you're trying to quiet the movement and improve your voluntary control. If you write small, make your pen really rough, put some tape on it, and write big. Use your whole shoulder, your elbow, not just your fingers. And if you shuffle, put some bells on your shoes. And when you walk and you're walking with nice long steps, try to make those gait patterns feel the same on both sides, right and left. And step big. Ride a tandem bike. Do something that is fun, that you like to do. I know some of you are still riding your bikes, and I'm a biker myself, but I don't think my husband and I could ever get along riding on a tandem bike together. But if the goal was to make me ride better, faster, and harder, then I would need to get someone who rode better than I did. Have fun by going to dance. You know, somebody says to me, I've never been a dancer, and I could say that I'm not a dancer, but I'm happy to get out there and jump around. Went to a party for someone retiring and picked up one of the neurosurgeons and had him come out and dance just to prove we can all do it, even if that's not our thing. Play competitive ping pong. There's a nice article about ping pong and improving fine motor control for Parkinson's. Box with a bag or with a friend or with a PT, and play tennis or hit balls against the blackboard. Hand-eye coordination is absolutely essential for all of us as we age. Make exercise fun. I'm married to somebody who hates to exercise, but he loves to play tennis. He doesn't want to get on a bike and ride because it's boring. So watch the news, watch a movie, do something. I put a desk around my bicycle, and I work on my computer and bicycle every morning before I come and push myself here on one of these body weight support systems. Smile when you exercise. Smile in your life. If your grandkids say, hey, Grandpa, are you mad because you're not smiling? That tells you you're not using your facial muscles and really expressing yourself as you should. Read out loud, loudly, slowly, clearly. Read poetry. We have people reading poetry while they're trying to run on the Alter G. Yell in the car while you're by yourself. Hold that yell long and sound that word out, and there's really positive evidence that it can help improve your speaking. With exercise, do the best you can to integrate some learning activities and match your challenge point. When something gets easy, it's too easy, you need to change the task and make it a little bit harder. Add sound, add touch, add anything else you can think of to make it more fun and progressive. I have patients walk on the treadmill and do Brain Fit, which is put out by Posit Science. But it doesn't have to be Brain Fit. You can take these things to the gym and do something similar. Find a book that you're going to finish reading so you can get done. In the exercise program I just showed you, here are our outcomes in our pilot study. Endurance improved. People maintained their function, and we followed them immediately after exercise and then 1 year later. And they increased their endurance by 22% immediately after exercise and still 26% better after a year. The gait quality improved even more a year later with about 44% swinging their arms and rotating their trunk. The actual depression scale decreased both immediately after exercise and continued 1 year later. There were a significant decrease in falls. It's rather remarkable that the number of falls for our group of 10 went from 37 down to 5 right after the exercise, and there were only 7 falls 1 year later. And also we noticed that there was some improvement in balanced responses, where you're a little faster at responding, and that difference was noticed more in 1 year rather than immediately after exercise. So this just gives you an idea. Decrease falls, improve your endurance, heighten the quality of your gait, and you're also going to be stronger, though we do no actual training for increased strength. But the more active you are, the more you use your legs, the more strength you're going to develop. Okay, and I would like to just suggest some other things. Walk around your house with a book on your head. Try to get a hat and put a level on it from Home Depot and keep your head level and properly placed in midline. You can also put a laser pointer on the beam of your hat and walk and point the beam at the wall and keep your head up as opposed to looking down. I already talked about putting noisemaker on your shoes. I also suggest you put a line in between all your doors and that you have to step over the line to get through. So some of you are going to say, I can't exercise. I'm in a wheelchair, and I believe everyone can do something. And that means that you can sit in a chair, turn right, turn left, reach for the back leg of the chair, reach down for the floor, reach your arms out to the side over your head, get a little TheraBand, pull it back and forth, dance and march with your feet, even though you're sitting in the chair. Practice standing up and sitting down, because you're going to have to get out of that chair to get back into bed or to change positions or to even get in the car. Read the news, do crossword puzzles, play Scrabble, play games. I started taking Scrabble games when we took my grandkids out to breakfast, and boy, it just made it a lot more fun, and I didn't have to yell at the grandkids to be quiet and to wait till the food came. Stay involved with recreation and social activities. There are many home programs that you can do to stay brain fit, and new technology is there for us. It's not just the brain fit and the insight from Posit Science, but Lumosity.com has got some great brain games. You can also buy Brain Age from Nintendo. You can get a Wii and do many of the sports games. You can get Kinect, and you can do iToy. There is something for everyone out there. The problem is using it. So I would like to just end by talking a little bit about exercise and neuroprotection. What do we know, and if we're not mice? So there's no treatment today that specifically slows progression or severity, and that's been mentioned by everyone. Dopamine replacement are not neuroprotective, but they do improve our motor signs. They just don't help us very much with our balance and some of our non-motor signs. Based on the evidence, the American Academy of Neurology and their quality standard review has issued these guidelines. No treatment is neuroprotective. Levodopa does not accelerate disease progression. Vitamins and food additives do not improve motor function. Exercise can help improve motor function. Speech therapy helps to improve speech volume, and manual therapy doesn't change anything. So promising neuroprotection is really coming about by animal-based research, and that is in animal models, forced exercise increases angiogenesis markers after 4 weeks of forced task-specific training. Forced intense exercise stops the development of the signs and symptoms of drug-induced Parkinson's, not real Parkinson's disease. But interestingly enough, if the animal is forced to exercise only one limb, then that limb will not develop the signs and symptoms of Parkinson's disease, but the other limb will. Increases in doing these forced intense exercises, we know with patients that we can increase the neurotrophic proteins of BDNF and GDNF in the substantia nigra and in the striatum, and this may eventually protect against cell loss. We can increase the dopamine within our dorsal lateral striatum, and we can alter the dopamine neurons. We can also, with forced exercise, alter the glutamatergic neurotransmission from the cortex, and it can mitigate some cortically driven hyperexcitability in the basal ganglia. In clinical studies, we know that immobilization appears to exacerbate dopamine degeneration, and intense exercise maintains motor function. Intense exercise spares dopamine and dopamine receptors. So we are moving in the direction that exercise may contribute to neuroprotection when other medication management and techniques are used. And I'd just like to point this out before I end, and that is forced exercise is better than voluntary exercise. In forced exercise, we will get greater motor benefits than we will exercising comfortably at our own rate. And that is a significant difference, because there are studies that say we can't be as good when we're not pushing ourselves harder. We do need more research about exercise, and I won't go through all of these slides about what I think needs to be done. I think it's been fairly well stated on many needs for research in Parkinson's disease. But what I would like to say is Allstate Insurance is translating what I talked about in neuroplasticity and memory and aging to reducing the benefits or the cost of your benefits if you do brain fit and you're driving a car and you have Allstate Insurance. What a great thing. So they send you the CD, and the biggest problem is nobody opens it. So they don't actually do the brain fit. Joining an exercise group may be cheaper than your latte. I'd hate to give up my latte, but I could easily give up my sweet bun. And I think it's great that you all do participate in some of the research studies that are going on here, and I appreciate all the people who've participated in my research. And I'd just like to say it's never too late to do something, and you want to minimize your risks and always try to find a way to manage your joint pains and exercise safely. Love your opportunity to exercise and earn a shower. See a PT, get a good exercise program for you. Read books, stay on top of the news, and sing and have fun. And grab a partner to dance, to ride a tandem bike, to box, play tennis, or ping pong. So thank you I would just like to say, these are my 10 commandments, and I won't go over them again because you'll get these. But to all the great researchers, I appreciate what they've done here at UCSF, and I especially want to just thank Erica Pitch for dealing with me and the Health and Wellness Center and making PT fun for patients with Parkinson's disease, all the patients who are here today and have worked with me in research, and a special thanks to Bill Crandall, who sends me everything new on the news about Parkinson's disease. And I think, just for fun, technology is coming to help us all stay young for longer and to exercise safely. And I'm not a supporter of the robots doing this for you, but my daughter-in-law is a robotic engineer from MIT working at UC Santa Barbara, and we're having a lot of fun coming up with different ways to exercise aggressively and keep our nervous system young. So thank you very much.